Welcome to NorthShore Health Centers. NorthShore is a nonprofit organization dedicated to providing quality, affordable health care to the uninsured and underinsured community of Northwest Indiana. NorthShore Health Centers was founded in 1997 by our CEO, Jan Wilson. I'd like to introduce you to Jan to hear her story on how NorthShore Health Centers was established.
I'm Jan Wilson, and I'm the CEO of NorthShore Health Centers. As a school nurse, I noticed that a lot of kids were having to miss school. It started as a teen clinic because of kids missing school, losing credit in school because they had so many absences that were justified. They were sick, but they had no way to get into the doctor. Either they didn't have insurance or their parents couldn't leave work. There was no way for them to get the antibiotics or the medication they needed, so they would end up just missing school, and it was very bad because they would sometimes actually flunk out because they missed so many days. So the superintendent and I decided that we had to find a way not only to help them, but to help their families. So we opened the clinic from 3 to 6 p.m. Monday through Thursday to start. We've been in Portage and in business as this health center for almost 12 years. We offer family practice, OB, pediatrics, dentistry, testing for labs. We also have mammography, ultrasound, x-ray. We have a 3D, 4D ultrasound. So from birth to death, we have services.
Although NorthShore Health Centers started as a teen clinic within Portage High School, it has now expanded to 5 medical locations, 4 dental locations, and 2 additional high school teen clinics, all providing quality health and dental care for everyone in need. NorthShore is proud to be among the many community health centers in America, which serve over 22 million people in low-income and medically underserved communities. Let's take a closer look at how these health centers are transforming healthcare in local communities today.
Every person I see reminds me of me. Any of them could have been me. It was me. And I don't think there's any reason for anyone to be turned away for any kind of medical care.
Today was a typical morning for me, and I saw patients speaking English, patients speaking Spanish, Somali, Arabic, Vietnamese, and Burmese. Those were my patients this morning.
And that is where I make my greatest impact, because I'm able to prevent illness. And that's what this is all about, preventive medicine.
I don't care what kind of insurance you have or whether you don't have, you're going to get the best care here. So if you don't have insurance now, when you get insurance, you still come see us.
I believe it's something we can share together, standing tall against the storm.
Others are talking about healthcare and how to improve access to services. Our community health centers have been doing it and have been doing it for 40 years.
I
am very alive and well, and it's all due to the community health center. And if it wasn't for them, I probably wouldn't be alive right now.
Sometimes I get a lot of phone calls. Are you diabetic? Well, we want to take care of you. I said, no, you don't have to. I got people that are doing that already.
It's a place where you're going to get excellent care by people who do care.
My community health center has been crucial to giving me a healthy body. I can use my pretty good mind and my loving God spirit to help others. Now, what more do you need for the good life?
NorthShore truly believes everyone deserves quality health care regardless of ability to pay, which is why we've made it our goal to not only provide quality health care, but to provide a range of services to improve the overall health of our patients and community. Our board-certified doctors and nurses specialize in many areas, including family practice, pediatrics, gynecology, obstetrics, behavioral health, radiology, and dentistry. Need immediate medical attention? NorthShore Health Centers also has urgent care in order to provide immediate medical care on an unscheduled walk-in basis. Our urgent care is available evenings and on Saturdays in order to treat patients who have an injury or illness that requires immediate care but not serious enough to warrant a visit to the emergency room. Let's hear from one of our urgent care specialists.
I'm Dr. SOBOLEWSKI. I live in the south suburbs of Chicago, and I work here at NorthShore Health Centers, and I practice acute care, primarily urgent care. Urgent care is kind of the treatment of acute or new onset illnesses or injuries that are generally minor in nature, however, require necessity of being seen. So they're kind of like minor emergencies, but usually the seriousness of them doesn't necessitate going to the emergency department. Occupational medicine is the care of people who are company employees and are either injured at work or require physicals or drug screening for the employer's company, depending on what their program is. At NorthShore, it's certainly a challenging job, but I find it rewarding because it gives me the opportunity to give health care to people who otherwise wouldn't have access to being able to be treated. And it's especially rewarding when you can do something for a patient and see the results of them getting better, whether it's sewing up a laceration or them having a boil that needs to be drained, which are things that I do, or having an illness that needs to be treated and then seeing that they got better a week later.
NorthShore also has 2 on-site pharmacies which offer discount medication to our patients through the government's 340B program. At NorthShore, we accept all forms of insurance, including Medicare, Medicaid, and offer sliding scale fees to the income eligible, so no one who needs care is ever turned away, regardless of their insurance situation or employment status. Our mission is to ensure that each individual has a medical home and access to the highest quality health care, regardless of gender, age, race, social, or cultural standing. Let me introduce our Chief Operating Officer, Rhonda Mendoza, to share more about the importance of NorthShore's mission.
I'm Rhonda Mendoza. I am the Chief Operating Officer for NorthShore Health Centers. I'm a mom, a wife. I live in Westville, Indiana. I have been with NorthShore for approximately 11 years now. And I come from a background of operations for private practice, but have a love and passion for community health center. I believe in the mission, and I feel that everybody, regardless of race, gender, ability to pay, has to have the best health care that they can possibly get. And I am a firm believer in that mission. I was on the private practice side for many years until Jan Wilson actually found me at a practice that she was trying to get a doctor to come on board with NorthShore, and I followed along, and Jan and I became very close. With having that background from different avenues of billing, clinical, I was able to help her and start up a practice management system, the billing, get credentialed with Medicaid and Medicare, and I have just grown with the health center and have worked my way up to be the Chief Operating Officer of the health center. Regardless, ability to pay, the color of their skin, the gender, that they all have access to quality health care, and we're very proud of that at NorthShore. There's community health centers across the United States, and I don't know that everybody always shares the same kind of mission that we do, and it's about having nice facilities, making patients feel that they deserve the best just as anybody else does, who has insurance, who has money. We don't want them to feel less than. And we're very proud at NorthShore that we have quality providers, and they're all about providing and following best practices in the clinical field. My experience at NorthShore, again, because I have come from the private world, I think that one of my favorite aspects is that you go home feeling that you really made a difference. Not that you don't do that in private practice, you're taking care of patients, and that's what the bottom line is. At NorthShore, you're taking care of some patients that could not get the care that we provide. They would not have ability to pay, and they go without. They will go out without medications, they go untreated because they can't pay. When you're being able to take care of those patients and they're able to get everything that they need to take care of their illness, that is the best feeling in the world. I am Rhonda Mendoza, and I am NorthShore Health Centers.
Children are a special focus at NorthShore Health Centers, and all 5 of our facilities include a pediatric specialty. Learning is essential for the future of our children, and continuous absences from school due to illness can lead to larger problems in the future. NorthShore focuses on the importance of well-child visits in order to provide proper medical care and prevent this negative cycle. Our doctors speak about the importance of well-child visits.
So well-child visits are just an annual visit that kids get, starting actually from 2 years of age. You start off coming every year to get just, like I said, anticipatory guidance, like seeing how you're doing, preventative measures, how you're growing, how you're eating, how well you're doing in school, if there's any questions or concerns you have, as well as getting vaccinations. Like for well-child visits for infants, you do it a little bit more frequently. So we see you first a couple of days after birth, and then a month after birth, and do 2 months after that. Same thing, it's making sure you get your vaccinations, make sure the parents feel comfortable with the care of their child, and making sure they don't have any questions or concerns, and making sure that everything looks healthy and that they're growing appropriately. I think it's very, very important to have your child vaccinated. I mean, we vaccinate for measles, mumps, rubella, chickenpox, polio virus, different type of bacteria. And with us having vaccination programs, we've eradicated diseases like polio in the United States compared to developing countries. So I think it's great that we have something to prevent kids from getting sick and having chronic diseases. I do strongly talk about how it is important to vaccinate, but if they decide not to, the importance of having their child brought in soon, making sure they stay away from other children who are going to get vaccinated but can't get vaccinated due to age or immunocompromised patients like cancer patients and things like that.
A well-child visit can occur every few months for some of the younger ones, and then yearly for some of the older children. And that helps them to get their vaccinations and for us to address normal growth and development and make sure it's up to par. There's so many diseases that children can have that we don't even know about these days because of the vaccinations.
Well child is, it depends upon the age group, because before age of 1 year we do the well child because the height, weight, their growth, their development, their milestones, how they are, whether they are appropriate with the age or not. Get the kids immunized, they will be healthy and well, so that they don't have any more complications or complication disease. And when they have the fever and all those things, if they come early, if they have, so we prevent developing into pneumonia and all the major diseases.
Prevention, wellness, screenings, and education are all necessary measures to keeping good health. It is not only important for children to get preventative checkups, but for their parents and all adults as well. Let's hear from some of our providers on why annual checkups are so important.
Annual checkups are very important especially for the female as well as for the male. Prevention is always better than the cure. So pap smear we do for cervical screening, and mammogram we do for the breast cancer awareness. We can detect the breast cancer at the early stage. Sooner the better.
You know, annual physicals are very important for preventive medicine, help to prevent cancers and to allow patients to address some of the problems that they may currently be having. It's very important, more so for women, but even for men too, especially starting at age 30 or so. It's important for them to get annual exams so that they can get their cholesterol checked, their prostate checked, and that can be done with blood levels. And starting at age 50, colonoscopies. It's important for women to get annual checkups for pap smears, and that reduces instances of cervical cancer.
Pap smear is very important. A pap smear test for any abnormal cells that are around the cervix, which could be an early indication of maybe some precancerous cells we could pick up early, and early detection is always the key. So we actually go in, grab some cells from around the cervix, send them off for testing, and then they come back and we let you know what needs to be done further, if it needs to be done.
NorthShore Health Centers is able to offer our communities dental services that meet the needs of everyone in the family. Our dental hygienists are available to clean teeth, examine patients for signs of oral disease, and provide other preventative dental care. Our dentists diagnose and treat problems with our patients' teeth, gums, and related parts of the mouth. They provide education on improving and maintaining good oral health, and also on diet choices that affect oral health. Is there a direct correlation between dental health and physical health? Let's find out.
Hi, I'm Dr. Christine Yonker. I am a dentist here at NorthShore. I have been a dentist for 3 years now. Dental health and your overall physical health are really closely intertwined. Gum disease, they've shown correlations to with heart disease. Dental infections can lead to bigger infections. People who have other medical issues like diabetes can exhibit things dentally first before they even know they're diabetic. And there's a whole scope of things that patients are probably unaware of that we can detect early if they don't see a doctor regularly.
My name is Troy Mannino. I'm a dentist here at NorthShore Health Centers. I've been a dentist now between 23, 24 years. We're the first people to address hypertension so many times. We're the first people to maybe key somebody in on the fact that they may be diabetic just from looking at their oral condition. There's a lot of things like that. Also the bacteria in the mouth we now know spread throughout so much of the body. So we know that we got to clean that up because these same bacteria pass through the joints, the heart, other parts of the body, and we're finding out more and more of the relationship.
As you are starting to see, at NorthShore we care for the whole person, which is why we stay up to date with medical technology to continue to offer the most effective preventative care. In 2011, NorthShore purchased state-of-the-art digital mammography equipment in order to be able to offer affordable and convenient mammography screenings. NorthShore is proud to be recognized as a Pink Ribbon facility. Our Director of Imaging is very passionate about giving women the opportunity to receive a screening for early detection of breast cancer. Let's hear more about what he has to say.
I'm Torabi. I'm the Director of the Imaging at NorthShore Health Center. I am a physicist, medical physicist, because of my experiences and the work I have in diagnostic imaging. I'm the director of the department as well as the imaging specialist. What we do, we make sure that everything is working. We make sure that we are meeting the standards. Mammogram is another radiation producing machine, and the mammogram was designed both for screening and diagnostic against the breast cancer. We are encouraging every lady at age 35 to come in for a screening mammography so that we will have a baseline. This baseline is just saying, is there anything abnormal or not abnormal? Then we encourage all of the ladies at age 40, some doctors, they say 45 or 50, to come for screening. What the screening is, we look to see if there is any abnormal problem or not. If it is, it doesn't mean it's definitely a cancer. Therefore, then what we do, we send the patient for further testing. The further testing is called diagnostic mammography. Then through the diagnostic mammography, different positioning and different procedure, then we will start determining if is that abnormality is a cancer or not cancer. When we choose the mammography here, we didn't look at other items. What we did, we look into getting the best, because as you know, mammography saves life in the ladies and in some men against the breast cancer. Therefore, when it comes to save a life, we will not compromise. No matter what the service contract is going to be, no matter how many times we have to change those detectors, no matter what we have to do, we will do in order to offer the best to our community. And that is part of my goal and objective, to be the best, not only in our community, not even in our state, to be among the best across the whole world. And yes, the machine we have here is one of the best machines, no matter if you look anywhere in the United States or anywhere in the whole world. We have one of the best units here at NorthShore. My mission of life, it was to help people. I could have helped people many different ways, but I choose healthcare. The reason I choose healthcare because I wanted to be part of helping the people. Well, the best is, number one, make sure that we have a home for everyone, not only for insured, not only for one class of people. We have a home, healthcare home for everyone, so that number one, no discrimination. When I start looking at my own vision, at my own mission, at my own goal and objective in life, and when I start comparing it with NorthShore Health Center, it matched. It matched so well that I'm enthused about my work. I'm enthused I'm here. I love it from the time I walk in to work in the morning until I walk out. I see what I wanted all of my life. I found it here at NorthShore Health Centers. I'm Tom Torabi. I'm the director of the imaging at NorthShore Health Center.
Our radiology department also has X-ray equipment and bone density testing to determine if a patient has osteoporosis. In addition to our diagnostic ultrasound equipment, which allows our technicians to view real-time images of muscles, tendons, many internal organs, and prenatal care for pregnant women, we also offer 3D, 4D ultrasound. Our 3D, 4D ultrasound equipment allows our expectant mothers to take home 3D images and 4D video of their babies. We also give patients the opportunity to record their baby's heartbeat, enclosed in a souvenir stuffed animal, so they can listen to their baby's heartbeat over and over again. Here is some more information on our 3D, 4D ultrasound experience.
NorthShore Health Centers believes that seeing your baby in the womb should be an unforgettable experience. A picture like this is just one of many you might see using new 3D, 4D ultrasound technology available at NorthShore. When it comes to your baby, don't settle for anything but the best. At NorthShore Health Centers, we strive to make your personal 3D, 4D ultrasound experience a time to remember. For more information or to schedule an appointment, call NorthShore Health Centers today.
Diabetes is the leading cause of blindness in America due to its effects on the retina. NorthShore Health Centers now has the capability of evaluating retinal disease through our IPAX exam. During the eye exam, photographs are taken of the retina of each eye to evaluate retinal disease. With this new technology, our diabetic patients no longer need to be referred to an ophthalmologist for this exam, which makes it more convenient and cost-effective. Our patients can also work with either a doctor or a nurse practitioner for treatment of their diabetes. Elizabeth Marcotte has more on her time at NorthShore and experience with diabetes.
I am Elizabeth Marcotte. I'm
a certified nurse practitioner. My dad was very sick when I was young. He had lung cancer and passed away, and in the care that he was given, a lot of the nurses made a very big impact on me and my family. So that kind of pushed me to go into nursing. Plus, I have family members that are nurses, and they seem to really enjoy their job. For the most part, if it's a very complicated patient that has multiple diagnoses, if they have a lot of chronic illnesses, they will see a doctor. If it's someone who maybe has high blood pressure, diabetes, those types of things, they don't have to see a doctor. If they're seeing a nurse practitioner, we can manage them on our own. And we see a lot of diabetes and a lot of hypertension. I don't know if it's because of the region. I think a lot of it has to do with our diets and the way people eat, and it's not just here. I mean, that's all over the United States. You see it all over the news, people saying, oh, you know, America's fat, and you know, they don't eat healthy, and I think it is true for any area, but yeah, we do see a lot of hypertension and diabetes. I like that we see a wide variety of patients, and we see a lot of patients that otherwise wouldn't be able to get medical care because other places don't take uninsured. Either that or they don't work with a patient on a sliding fee basis. So we're open to more patients, and we're able to care for more that need it the most. I'm Elizabeth Marcotte. I'm a certified nurse practitioner, and I work at NorthShore.
These are only a handful of examples of how NorthShore Health Centers is constantly making improvements and additions to our services and staff in order to provide the best possible care for our patients. We at NorthShore want to be your medical home. A medical home isn't a place. It's a team of healthcare professionals who are always there to help you and your family understand and manage your health. As I said before, we care for the whole person, which is why we offer an array of coordinated services to improve your overall well-being and life circumstances. Don't put off getting the health care you need. Visit NorthShore Health Centers today or call us at 888-476-1605 and make NorthShore your medical home.